in the heart of Peterborough. This is Salam Radio.
Assalamu alaikum. This is me, Dr Shabina Asad Qayyum for Salam Radio 106.2 FM. Do you know, I'm going to say something to all of you, whether you're driving your car back from work today. I've noticed that I've got this habit, and the habit is that whenever I pick up the phone, I automatically assume that the person on the other end will know who I am. So I automatically say, hello, or assalamu alaikum, it's me. And I've been told, who are you? But here, the added advantage is that on Salam Radio, me, Dr Shabina Asad Qayyum, is here at your service. I'm absolutely delighted to be back, introducing and presenting to you the Body, Health and Mind show on Salam Radio 106.2 FM. And in fact, you know who this me is. So it's great to be back, everybody. I know that I conduct these shows after every so often, and then I come back, put in a whole hour of a show, and then all of a sudden say, well, I'll see you next week. And then I disappear for a few weeks. But that's not in my control. Honestly, I had gone away on holiday to Pakistan with my family, and I absolutely loved it. But the really sad state of affairs is that we know that Pakistan has been hit by some horrendous flooding. There are thousands and thousands of people that have been displaced. 1/3 of the country is underwater. So please, let's take the opportunity to make dua for all of our brothers and sisters in Pakistan who are suffering. And I think that it really does give us the opportunity to reflect upon our blessings and see how blessed we are to have a roof over our heads, to have food, and to be able to buy things that we like, and to buy things for our children. And these are things that many people who are well off don't consider, but this will form part of my show and will form part of my discussion. So without further ado, I'd like to welcome you all, and we're going to go through what I introduce. I want you to really interact with the show like you usually do. So if you would like to say something, you can text or you can comment under the Facebook Live, or you can call me on 01733 602 133. You can text on 07411191062. We've already got some comments that have come up. But what I'd like to do is introduce you first to my wonderful, wonderful guests. And I have been waiting a very long time to have him on my show. And I sprung a surprise on him last night. And he has very, very kindly offered to come on the show today. And he works very hard. He's a very dear brother and very special to me indeed. So I'd like to introduce Mr. Hassan Walji, who is a pharmacist at Acorn, not Medical Centre, but Acorn Pharmacy in Huntingdon. Brother Hassan, assalamu alaikum.
Wa alaikum salam. Thanks for having me.
It's wonderful to have you. And do you know, the listeners don't know this, but we have, mashallah, such a wonderful, our families have such a great relationship, and we have such conversations, don't we?
We do.
About the state of medical services, about the NHS, about the predicament of patients, of our experiences as health professionals. And we both complement each other as well in that way, in our various aspects of fields. And I just want to really pay ode to you in the work that you and your colleagues are doing throughout the country, because you're honestly, your community service is commendable and it's wonderful. So thank you on behalf of us and Salam Radio and the wider Muslim community in Peterborough, and indeed all of those that are listening live throughout the country. Please know that we have a wonderful person who offers public service, and that is Mr. Hassan Walji, as a pharmacist. So without further ado, I want to ask you, tell me a little bit about yourself and what made you become a pharmacist. Tell us a little bit about your journey towards...
Okay. So I suppose we've always been a family of public service. So Dad was a dentist, which will be known by many fellow Peterborians. He worked for many years as a dentist. And we always believed, and he always taught us to give back to society, to give back to the public. And we have, alhamdulillah, my elder brother, he's also a pharmacist, and he was very instrumental in the start of my journey. And the rest of the family have been very, very focused on helping society as much as they can. So started with actually getting, it was very medically orientated, the family. When Dad would come back, we would be discussing the NHS, which he loves, and also how to help patients, how patients were helped by him. And then gradually, slowly, my interest in chemistry was nurtured, and pharmacy was a natural choice for me.
Yeah.
So I chemistry at the time, pharmacy with pharmaceutics, and medicinal chemistry, pharmacognosy, which is the study of plants to make medicines. And it was all fantastic. Learning it at university, it was one of my, in fact, dissertation was on pharmacognosy and therapeutics. So, and looking at certain cancer agents as well. So it was, I think with university, they say you have to enjoy university. I mean, you definitely enjoy the social element of university. But I think when it came to the education that I got from university, I'm very thankful. But I'm also very, very, I thoroughly enjoyed that.
Yeah. It sounds so refreshing to hear that, because when I'm talking about the subject pharmacy, but actually it wasn't. What was the name of the subject I read it in medical school? What was it?
Was it pharmacology?
It was pharmacology, yes. It was pharmacology. I don't know what's happening yet, but because we've been mentioning pharmacies, but pharmacology was one of the subjects that I was weakest in. I remember reading it in third year, and it was so volatile. And I remember a friend said to me, "Don't worry," I was panicking before our yearly exams, and she said, "Don't worry, just remember that the side effects, every single medication is diarrhea, vomiting and nausea." I was like, no, it's not. But there's obviously so much to it.
Absolutely.
And was your forte organic or inorganic chemistry?
I would say it'd be organic chemistry.
Oh my goodness, yeah. Yeah, inorganic for me as well was just pretty much, I don't understand. But yes, and it's really great to hear that you have such a family that is engrossed within the health service and public service, and it's so gratifying, isn't it?
Absolutely.
Especially when you're working with patients as well.
Absolutely.
It is, because it involves a lot of public interaction, and we work in the community, especially within this field as well. It's great to hear that your elder brother as well is a pharmacist, and obviously your dad, uncle, who is very dear to us, gave a very long innings of public service as well, and was a wonderful dentist too. So that's really heartwarming. And you're currently at Acorn Pharmacy as well. Do you have a very large population there that you serve? We
do. I'm in the heart of the Oxmoor estate in Huntingdon. They're a wonderful population. I love going to work every single day to meet these very wonderful people. It's such a privilege to work with them, and help them in any way I can through the pharmacy, and also working with the people I work in that building, the fantastic Acorn doctors, the staff at the Acorn, especially my staff. I mean, any pharmacist will tell you that they themselves are not the pharmacy heart. It's actually the staff that work with us. So it's such a privilege to work in the locality. Yeah. What time do you start in the morning? So I normally start at 8:15, 8:30, and we close shop at 6 o'clock. Oh my goodness. So 8:15 or 8:30. And obviously living in Peterborough, that means negotiating the traffic early in the morning, which we all have to do. And I'm familiar with. And if you have children, you've got to do the school run as well. Absolutely. It's just trying to sort of negotiate all of that. So we all know that too well. Those of us that sort of are trying to tackle the traffic in the morning. But that's absolutely great. And look, guys, if you're listening to Salam Radio on your way home, or whilst you're doing something in the kitchen, or you're cooking dinner, just give us a shout out and interact with us. You can call us on 01733 602 133, text us on 074 1119 1062, and we have a live stream on Facebook, YouTube, Twitter and Twitch as well. Show us some love and speak to us. Ask us questions as well, because that is what these shows are about. We try our very best to bring shows that are contemporary, that are that bring you the latest news and information. Obviously try to help you, because
one of the things that we have a problem with is obviously GP accessibility, isn't it, Brother Hassan? And pharmacies are obviously doing a lot in terms of their bit in contributing in partnership with GP surgeries, and you do a little bit of that as well. Would you like to explain a little bit to our listeners what that sort of involves?
Absolutely. So there is a new government scheme. It's called the Community Pharmacy Consultation Service. And what that enables is that whenever you've coming in or you've come down with an ailment that perhaps, you would automatically go to the GP for, it might be best dealt with by the pharmacist or the pharmacy team. So we're talking about minor ailments, nausea, vomiting, things like that. And what the GP is able to do now is able to refer you to the pharmacy team and have a consultation with the pharmacist to see whether they would be able to help you in the first instance.
Okay.
So that's a very successful service that we have in Huntingdon. I'm very, very happy that I've been taught by probably the best in terms of the acorn surgery doctors, and we are working flat out to help our local population.
I'm sure you are. I'm sure you definitely are. And what I'd like to ask you, Brother Hassan, is, first of all, we've got some people who are listening. We have Lee Taylor. Yay, hi. Hi, it's Lee. Always good to listen to you on the show. And it's wonderful to have listeners here. And we've got a wonderful guest as well. So thank you very much for those thoughts, Lee. And join in, ask us some questions as well. It's very important that we know those questions. So going back to what you were saying about, obviously, what you're doing, I know that GPs will often refer to pharmacists for minor illness as well. And given that GPs are consulting over the telephone, sometimes the only gaps that one would see within that, or the discrepancies, are that you're not able to examine patients. So the mild sort of, the nausea, vomitings, the diarrhea, to get some rehydrations. Are there some things that you have to then bounce back to the GP often, or is that not so?
Absolutely. So I suppose it's down to the pharmacist training. Some pharmacists are now being taught consultation skills. They're being taught how to examine patients. So that's hopefully a bridge that is going to be built very soon. Speaking from my own experiences, I've had that training. So when a patient comes to the Acorn Pharmacy for a consultation, they're normally examined, and I'm supervised by a GP there as well. Okay. So it's a very unique service. It's a service that is, I suppose, it's like a beacon of what the future of pharmacy probably is going to hold.
Yeah, and I think it's a good idea. Again, we're talking about the partnerships and agencies working together. So just for example, say that I was speaking to a patient who's displayed to me, symptoms of having a bit of diarrhea and sort of, and I would say, right, but I'm okay. I'm not feeling faint or anything. And the GPs ask the obvious questions. Why don't you go down to your pharmacy? So do you have an appointment template in which the GP books into, and then you do that, or?
Not necessarily. So according to the framework, it's a walk-in service. So pharmacy doesn't need appointments, and you can walk into the service, and you can be seen by a pharmacist in a private consultation area. So they have their own consultation rooms, kitted out, and given all of the confidentialities that one would expect when seeing another healthcare professional. Of
course, and I think that that's really good. Can I ask you that when you are seeing patients, obviously, is there a waiting time? Do they have to wait? Because you've got to negotiate a lot of other things as well, haven't you? Giving prescriptions out, you do so many things.
So to all of those of you in Huntingdon who are listening, so sorry you've had to wait so long to see me sometimes. Yes, there unfortunately can be a bit of a wait to see a pharmacist. I would encourage you all, whoever's listening, please bear with us, be patient with us.
Sure.
It's a very, I think, pressurized environment. I think as healthcare professionals, I think everyone is feeling that pressure now.
Of course they are.
And the workload is just increasing. Yeah. So it's I work with a fantastic other pharmacist, and we managed to get through the day.
Yes, well, it's praiseworthy what you do. And actually, we've got Wendy Chandler has just sent in a comment. Hassan is so helpful and goes above and beyond to help you. So that validates the wonderful work that you're doing in the community. And that's why it was important to nail you down and get you here today, you see, brother. I wasn't going to let you escape at all. So I'm actually now really glad that you have.
No,
so,
my pleasure.
John Toomey, I've absolutely no problem with being helped by pharmacy teams, but there is a need for all clinicians to actually see patients. We need to develop a proper and full understanding of when, where, and who. Now, John is somebody who has a great insight into health services. He is a Unison representative as well, and also looks into and represents people who are working on the front line. So he knows very well the pressures that we face, both in primary care and across secondary care, and obviously in the community too. So he really does make a valid point, doesn't he, when you think about sort of what it is that patients are going through. We're trying to understand in primary care, Brother Hassan, about meeting need and accessibility. That's been a real problem, and we all know that for a really long time. However, the factors and the reasons are many, aren't they? There's been a lack of funding, obviously, to services.
Absolutely.
Part of the problem as well here in Peterborough, and I think Huntingdon relatively, is that there's a real shortage of GPs. And the ratio of patients to GPs is, on another level, isn't it? We've
Absolutely.
seen. So a safe ratio, we say, between patients and GPs is around 3,000 patients to one GP, but we've seen a ratio of one GP to 9,000 patients. And that way, and I'm trying to sort of make an attempt to answer John's query or to sort of supplement it. It's not clinically safe now with those kind of ratios to see every patient face to face, although John makes an absolutely valid point. It makes for safer medicine and practicing, doesn't it?
No, absolutely. So I totally get that. But we've seen this gradual shift from everybody in their own corner to starting to get together in the middle and being part of a wider healthcare team. So it's no longer, I'm part of the community pharmacy, I have nothing to do with the GP practice, I have nothing to do with the dental practice, I've got nothing to do with the nursing team. It's now a shift where everything's amalgamating, certainly with information, with resources, with sharing, which is why sometimes we see pharmacists in general practices.
Mm-hmm.
In fact, there's a big push for pharmacists to go into general practice.
Yeah.
And working with the wider healthcare team to get that recognition out, that actually the healthcare team doesn't necessarily is not only a doctor or a nurse. There are other physiotherapists, dentists, pharmacists, nurses, are all part of that healthcare team, and it's actually accessing the service that is most needed by an individual. I think that's very, very important.
Yeah, I agree with you. And the other thing I'd just like to say is that, we have a pharmacy. We've got pharmacists in our practice that do a wonderful job. I'm not going to tell everybody what they do, but could you highlight some of the responsibilities that pharmacists have within practices when they work there?
So,
apart from seeing patients, obviously you do.
Absolutely. So pharmacists can do medication reviews. They deal sometimes with medication discharges. They manage long-term conditions. So the practice pharmacist that works with us is very good at anticoagulation, at controlling people's blood pressure and doing medication review in terms of cardiovascular disease or asthma. And so, they're very good and they optimize. They get the medication that you require, that you need. Not necessarily, my friend has this medication, so therefore I need it. It's actually what medication is good for you. Yeah. What medication will work for you? Which medication would be safe for you? That the most important questions. And then rationalizing all of that, getting your therapy, getting all of your needs together and advising on the best treatment.
Yeah, and I must say that the reason why I find your input invaluable, and I'll give an example of this, is that you'll probably remember during COVID, what happened was we had to switch from those people that were on warfarin to a DOAC. Yeah. Yes, rivaroxaban and all of those other medications in the same group. And there's a protocol to follow with that. So here we have a protocol to follow, and not every patient fit within the realms of those protocols. And I can remember picking up the phone and saying to our in-house pharmacist, Tim, him, I need help. So he would come along and he would actually, yeah, okay, yes, well, their EGFR is a little bit like this. And I think that rivaroxaban would suit them. And then obviously you had those patients who said that, no, we want to stick with warfarin.
Absolutely.
So it would be really, really difficult. So we've had that. And the other thing is that I think that the pharmacist's role, and I'd like to talk to you a little bit about this, in controlled drugs, that is a role that it has a lot of challenges, doesn't it, for you? Would you like to explain to the listeners what your experience is with patients and sometimes some of the challenges that you have to face?
Yeah, absolutely. So controlled drugs are drugs that we have certain schedules of controlled drugs. So you start with a Schedule 1 drug that you would not see in the community. And then you'll go with a Schedule 2, which are normally seen with patients who are experiencing pain.
Yeah.
So we're talking about morphine, we're talking about oxycodone, and things like that. And obviously, with pain, these drugs they're dangerous. Not only are they very good, they're very good. And when you need to have pain relief, then absolutely you should be getting the pain relief that you need. But we also know that these drugs are addictive. So it's the fine balancing act of whether we can control your pain. Once we've controlled your pain, are we able to titrate down? Mm-hmm. Or, of course, inevitably, we might need to titrate up. And it's the legislative work that goes around a prescription for controlled drugs. So if a doctor prescribes now pregabalin, for example, or they prescribe something for pain, it's after the shipment inquiry, it's a lot of the onus onto the balancing of those controlled drugs, and the access to those controlled drugs are very, very, now, should we say, they're tightened up on that. And we have to make the system safe. And it's now more about accountability. It's more about when a prescription comes through, it's finding out the need of the patient. Do they need this medication at this dose? Mm-hmm. And absolutely asking the questions when you need to ask the questions to the prescriber. Is this appropriate? Is this correct? And I think COVID has taught us a lot about that.
It has.
So it's allowed us to come out of the shell that pharmacists may have been in, but it's absolutely opened up widened up the scope of pharmacists now to pick up the phone, or even to speak to the GP face to face and say, excuse me, can we talk about this, or can we talk about the medication? And they're very receptive. And I haven't come across anything inappropriate, but absolutely they value the questions coming their way, and actually it's fantastic, I think.
Yeah, I think it is. And I think that it's wonderful that you have that experience. Sometimes it can be very difficult, though, can't it, for other pharmacists? And I often, on a very busy on-call, will be called up by my pharmacist. I, by default, just pick the phone up and say, right, what have I done now? So it's very important that you have that really effective relationship with each other as well. And I think the other thing is that, do you face any patients that are upset about not having their medication? How would you deal with those tricky scenarios with patients being upset that there's a controlled medication, or in fact sometimes those that say, well, we never received our prescription?
So that actually unfortunately has become a very big problem for all community pharmacists across the country, who do a fantastic job. So what they're doing, so what's happening at the moment, is that we're having a number of prescription drugs that are going short, not available in the market. So it doesn't necessarily have to be a controlled drug, although morphine is, believe it or not, one of those in some shortage or lack of supply. We had a massive problem just a couple of months ago with HRT, not being able to source a whole portfolio of HRT. Obviously, that in itself is very problematic, and we have very upset patients coming through. Rightly asking, where are these medicines? And, for the first time in 16 years, 17 years practicing as a pharmacist, I'll say, I don't know. I just don't know where.
Oh, my goodness.
How I can get this to you, what we'll be able to do to get this to you. And it's a lot of work. It's a lot of work trying to source medication, especially I feel personally responsible for my patients in Huntington. So if somebody's not getting a drug, it's like, why? How can I get it for them? And then you realize actually it's a nationwide problem, and we have to go with an alternative. And sometimes there are no alternatives, and sometimes the alternative that you feel, for example, the application of a topical gel, all of a sudden you have to apply a patch.
Yeah.
And that's a change, and that needs to be explained, that needs to be counseled, that needs to be understood by the patient as well. So, you know, yes, there have been some upset patients, and what I would say to patients out there is we really are trying our best to get the medication to you, and sometimes it's just out of our control. I from bottom of my heart, I apologize for that.
Oh my goodness. So it's so sweet that you are so empathetic. John has made some really relevant points that I'd like to discuss after we come back from the break. The other things I think that are very important to discuss are touching upon the shortage of medications, the reasons why, what type of medications are in shortage, and what we really need to do in terms of sort of thinking about, like you say, counselling patients and how we can help them, and where there's never an alternative. And the future of the NHS, I think, are some really relevant things that we can talk about after the break. But until then, we have the wonderful Mr. Hassan Walji, a pharmacist at the Acorn Surgery, at the Acorn Pharmacy in Huntingdon, who is here and joining us today. So we have much to discuss after the break. Don't go anywhere. Those of you who are listening and commenting, stay with us, because there will be a lot more to talk about.
Stay tuned to Salam Radio after this short ad break.
हाँ जी जनाब आज तुसने किया 12 बजे वे
जरा फैमिली की बाहर खड़ना चाहना या खिलाने पिलाने से सोचना कुथे जाओ
इस च परेशानी है लिकड़ी गल है इब्राहिमी बफे रेस्टोरेंट पर जाओ उते फ्री पार्क करो उन्होंने मजेदार ते स्वादले पाकिस्तानी इंडियन चाइनीज ते इटालियन आय 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 खाने ना ते जोड़ी कोई नहीं नाले सस्ते ते स्वादले
ए तेरा अक्सर इसका मतलब है बटवा भी नहीं होला होनेगा इब्राहिमी बफे रेस्टोरेंट वैरायटी ऑफ डिलीशियस डिशेस के अलावा जेलाटो आइसक्रीम एंड वॉफल्स भी करते हैं वीकेंड्स पर अपना टेबल बुक करवाइए और वीकडेज तशरीफ ले आइए ओपनिंग आवर्स शाम 5 बजे से रात 10:30 बजे तक इब्राहिमी रेस्टोरेंट 63 Sycamore Avenue Peterborough PE1 4JP टेलीफोन 01733 313131
The flooding here is on an epic scale, with streets turned into rivers and entire districts submerged by the unending cycle of monsoon rains.
The floods in Pakistan are devastating. Please tune in to Salam Radio from 4 p.m. on Saturday the 10th of September for a live appeal. Hear from those on the ground in Pakistan, and please donate what you can to help UKIM raise funds for critical aid. Please donate by calling the studio from 4 p.m. on Saturday the 10th of September on 01733 602 133 or donate online at ukim.org.
I don't know how to rebuild my destroyed house. Even I don't have anything to feed my family. I lost everything. I don't know where to go. God help me.
It's estimated that 5,760 children become orphaned every day, and the numbers are rising. UKIM ensures that the orphans we sponsor receive healthcare, food, education and shelter to show them that there are people who care. This Ramadan, from just £30 per month, you can make a real change in an orphan's life. Your sponsorship will provide them with much needed essentials to ease their situation. For orphan sponsorship, call now or visit ukim.org.
Where can you get high quality and low prices? Amar Food Store and Halal Meat in Lincoln Road, Triangle is the place to go. Pay us a visit and take advantage of our special offers and great range of products on groceries, vegetables, fruits and halal meat. Also send money to Pakistan absolutely free. We have all top brands at special offers, offer free customer parking and provide a free local delivery service. Amar Food Store and Halal Meat, 613B Lincoln Road, Peterborough. Call us on 01733 687 374. High in quality, low in prices.
At Cake Inn, all our cakes and slices are freshly baked for that delicious taste. At Cake Inn, we bake 100% vegetarian and halal eggless fresh cream cakes. Delicious flavoured cakes for birthdays and weddings, ceremonies and all other occasions, with free customised messages, even balloons and candles too. Order for delivery or collection from Cake Inn, 489 Lincoln Road, PE1 2PE, and your cake could be ready within 2 hours. Find out more and order online at cakeinn.co.uk or call 01733.
If you have an idea for a show and want to get involved, email info@salamradio.co.uk.
Assalamu alaikum. We are back. I'm back. It's me again, Dr Shabina Asad Qayyum for Salam Radio 106.2 FM on the Bodily Health and Mind show. I am a GP, so I've got to tell you about myself, but you probably know already and are sick of knowing where it is that I work, but I'm going to tell you all the same. I work at Central Medical Centre. I'm a GP there, and actually I'm going to be completely biased and say it is the best practice on the planet, and I have some wonderful colleagues, so there. And I actually have a pharmacist from the best pharmacy on the planet, although we've got one around the corner as well, which is also good, but I will reserve my opinions and we'll decide which one is the best after the show. But we have Mr. Hassan Walji, who is a pharmacist at the Acorn Pharmacy in Huntingdon, that is also affiliated and attached to the Acorn medical practice over there, that has a very large patient population. Before the break, we were talking about many factors, what the roles of pharmacists are in the community, how they can help, how they're helping with the challenges that primary care are now facing as well. And after the break, we've got some great comments that have come on board. John Toomey, who is great to have your input, John, I must say that. Somebody who has represented healthcare professionals all across the board and all across public service and has given some wonderful comments. So, Brother Hassan, we will talk about these and we will discuss them actually, because I think that it would be a really good idea. So, John has said that I remind myself every day with a BBC recording of the trauma a family went through trying to get an ambulance, which ultimately left the patient unattended and dead. Now, we all know that, like you say, and like we've spoken about, the pressure on some of these emergency services, especially primary care, pharmacy services, is risen exponentially over the last couple of years as well. I happen to sit on my other role, I happen to sit on the Health Scrutiny Committee, and we have reports from the East of England Ambulance Service and some of the targets that they're trying to meet. Now, I have certainly seen general practice in medicine and the NHS change, whereby targets have now become a thing, haven't they? Absolutely. Everywhere. And whilst it is very important to make sure that we are being appraised and that there is auditing, processing going on to see that we are efficient as services, there are often those events that we all look back at and say, do you know, never again. And we would never wish that upon anyone, would we? So yes, our ambulance services are, but what do you have any comments at all listening to that comment?
I think it's very important that when patients decide to choose a service, that they choose the most appropriate one. There are going to be conditions that may not need A&E access. They may not need to call an ambulance for it. They may not need to see necessarily a doctor for. They may get the right level of care, the most professional care, from a nurse, from a pharmacist. So I would really ask, think about the service that you require. Yeah. I understand when you're unwell, or when your child particularly is unwell, you want to go out and get that service now. However, when things can be treated at home, such as viral infections, which are not going to work with antibiotics. So I would strongly suggest to your listeners to think about the service that you require. Particularly with the waiting time in A&E, the waiting time for Category 2 ambulance calls, it's getting high, and unfortunately there are going to be some tragic events.
Yes, they are. And do you know, the reason why I just want to pick that point up here, Brother Hassan, is because John has also come back and says, please remember that we are trying to cooperate and complement each other's work. We're not competing. 100% agree with that. I think that that's a wonderful thing, that united we stand, divided we fall, says John, and all for one and one for all. We resonate with that, John. And I think that that's very important, that we're all united. And the reason why, John, we're having this conversation, Brother Hassan and I, is because it's important to educate our listeners. And for those of you who are listening, it's very relevant that making the point about using services appropriately is because you will get an efficient service wherever you go, if it's an appropriate one. And therefore, you take the burden of those services that are used and then aren't needed, for example. And the reason why we say that to you listeners is because in Brother Hassan and in my experience, there have been no amount of times where we have come across patients that have had to call an ambulance because in a split second they felt a bit unwell, and you know, it's been difficult for them to cope. Let's put it safely, it's been difficult for them to cope in that little instance. However, their condition hasn't been life-threatening, but they've called 999. And some people just don't know. It's not to say that, you know, patients are being objectified. That's not what the reason why we're having this conversation. But it's important that 999 ambulances should only be called in life-threatening conditions, because if you don't, that ambulance could be needed by somebody who could be transported to hospital and whose life could be saved. And then we wouldn't see incidences that John has just mentioned, that BBC documentary where the ambulance couldn't attend. They may have been preoccupied elsewhere. The delay could have happened because of these factors. So it is so important that you use the service appropriately. So thank you for that. And John has also said that I respectfully suggest that we need a consolidated NHS that ensures that there is a required engagement, which we've already spoken about as well. And John has said here that he'd like to switch subjects slightly. There is a desperate need to build more communication channels so that I'm not blocking a patient in need of real help with my query about the timing of a consultation. We need to separate and channel queries. I doubt if any of us take any pleasure in being patient 29 in the queue when I only want to change an appointment. Communication does need to be better, and I think we've spoken about this before, isn't it? Accessibility is a real issue, isn't it,
Absolutely.
Brother Hassan, as well? With yourself, I know that patients generally, your modus operandi as it is, that patients, it's a walk-in service and, you know, you generally see people face to face.
Absolutely.
But I think it's important here as a health professional for you to give your comments on GP accessibility. What has your experience been? Do you have patients who would talk about the fact that, you know, it's difficult for them to get in touch with GPs? I certainly do. I'm a GP. I put my hands up and say that, yes, it is a problem.
Yeah, absolutely. I think many patients that we do speak to from across the spectrum talk about that actually getting hold of a GP is difficult.
Yeah.
But then we need to also realize that GPs are also human.
Yeah.
As are other healthcare professionals, we're all human, and there is only so much, and so for to hold safe and effective consultation, you need to give that patient your 100%. You need to be able to listen to them, and then prescribe or diagnose appropriately. And so, you can't expect that to be done in a couple of minutes when it comes to with any consultation. So. And I think this comes down to the shortage of doctors and also shortage of other healthcare professionals. In pharmacy at the moment, we're seeing a massive reduction in pharmacist numbers.
Mm-hmm.
They're being redistributed elsewhere. And that's causing a massive effect on the pharmacy, getting hold of a locum, getting hold of a pharmacist to come and work on certain days. Can be challenging to other pharmacists and other pharmacies, particularly the independent pharmacies. And my heart goes out to them. I totally get it, the pressures that they are under, the pressures that GPs are under. You know, everyone is under a shortage.
Yeah, and it's very sad that that's the case, but we need to do more so that people feel a lot more valued. And I think that we work in, like John was saying, partnership, number one with each other, and also with our patients and our patients with us. So it's a very complex mesh of relationships that have to all be working efficiently so that we can give the best possible service and patients have the best possible experience.
Absolutely.
With as little red tape as possible. I say that in the most apolitical fashion ever. But I'm sure that those listening understand totally what I mean, as you will be as well when we have our conversations later on about how the show went as well. Now, let's talk about this aspect, because I'm conscious of the time. The real shortage, John has also said, the real shortage of drugs is a crisis for which our pharmacists cannot be held responsible. Thanks for the really informative explanations. We are all on the same side. We absolutely are. But let's talk about shortage of medications. Let's talk about it. What has your experience been? So we were talking a little bit about, I've seen there's been a shortage of capsaicin cream, which is for pain relief. And actually, I was told that the capsaicin cream that I wanted in that strength, 0.025%, is not available, and it's available in 0.075%, which is quite warm when put on. So I was faced with a predicament as to whether to prescribe it or not. But I did, because I wanted the patient to have something to help with their pain. So what drugs are being short, and why? What is the reason behind it?
So the shortage of medicines, we talked about HRT being a problem. There are a number of shortages coming out every day. They can come from a strength of SSRI, for example, drugs that are used in depression. Certain drugs for pain relief, again, are going out. And the question from many people is why is this happening? The real answer is that actually there is a number of things that have taken, it's a domino effect that has taken place. Obviously, we've had Brexit. Now, Brexit has posed us challenges. We came out of the EMA, the European Medicines Agency, and we also came out of the flow of products and goods into the UK. So we were an EU, a united Europe, and the way the drugs used to work was that we were able to get drugs from other member states quite freely, accessibly, because we were not confined to certain legislation. But now that has changed, and that is the way we're going. And of course, licensing medication takes time, and getting medication. Sometimes the drug companies might turn around and say, actually, it's not worth us staying in the market.
Wow.
Generics, again, will be that's a generic issue as well. But I think the shortage of medication, it's anybody's guess at the moment. I mean, there are certain medications that are going out, and you're thinking, how is a 10 milligram strength going out, but the 20 and the 40 are staying in? Even to us, pharmacists, we just don't get it sometimes. And explaining that and all the confusion to our patients can be difficult.
Yes, it can be. So we've got SSRIs that are on the shortage. SSRIs, for our listeners' purposes, is a medication that's predominantly used for depression and anxiety as well. That is very worrying, isn't it? Do we have waiting lists for these medications, or is it just that they're not being manufactured or they're not being sold in the UK and we can't procure them?
So we can. So you can now get them. So they were getting a bit short, and what then happens is the cost of those medications go up.
Right.
But the reimbursement
You're listening to Salam Radio, and it's now time for Maghrib Azan.
Right.
In relation to that.
This Azan is sponsored by Park Foods. Come and see the difference.
We are going to an Azan, and we'll be back after the Azan.
Allahu Akbar, Allahu Akbar. Allah. أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمداً أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله
الله أكبر الله أكبر لا إله إلا الله اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم وبارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار اللهم بك نحيا وبك نموت وإليك المصير رضينا بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم نبيا ورسولا
Assalamu alaikum, we're back. So for those of you who are not Muslim, just to explain. Oops. Please excuse me for that intervention. I forgot to press the pause button. That's okay. So we usually have a call to prayer for the sunset prayer known as the Maghrib Azan, and that is why we had to take a break. So we are back now and just going on. So, Brother Hassan, let's talk a little bit about the cost of living crisis in the last couple of minutes. What impact have you seen on patients?
I think everything's becoming more expensive. From the pharmacy perspective, actually, drugs are becoming more expensive, and the remuneration for those drugs are not as what we're paying for them. Now, some of our patients, and there are some, and we've seen some patients coming through and asking if they're paying for their prescriptions, actually, which one do I need to help me, to make me live? That's a question, that's a difficult question sometimes to answer. And, you can't choose which one a patient needs. They're prescribed because they're all needed. And I would urge listeners that if there is a problem with prescription payments and things, you can get help. Ask the pharmacy team. Mm-hmm. There is a HC1 form that you can fill out to help you with the cost of prescriptions. I would urge you to find out. The job centre also has that. So please do have a look. You don't have to. They will help you. But yes, it's difficult. It's one of those difficult conversations that you have with patients. As healthcare providers, you have that ethical responsibility as well, and it's one of those things that it's a journey together. We have to discuss this, and we have to understand that actually the prescription, which I need to get out here now, actually is that if you are paying for your prescription, the £9.35 that you are paying does not go to the pharmacy. Mm. Okay, so this money is not paid to the pharmacy. It is paid back into a global budget for government. It isn't. And it does not go to the pharmacy team. So please don't think that you're paying $9.35 per item and it goes to your pharmacy. It does not go to your pharmacy. Okay, so we together, I think, with discussions, I think we need to sit down and have a really, really important conversation as to whether actually the prescription charge is required. We see other nations in the United Kingdom that don't have the prescription charge, but also with the cost of living, we also have to think about actually can they afford their prescription? If we're thinking about gas going up to the levels there are, we don't know what's going to happen in the next couple of weeks with new government, and also with inflation the way it is. Of course, people are not going to want. They're going to want to think about what medication they're going to be taking.
Yeah.
So I think it's an important conversation to have. I wish I had the answers to that. If I was able to, I would scrap the prescription charge.
Yeah.
But yeah.
Don't we know it, Brother Hassan? In fact, it's heartbreaking.
Absolutely.
It's heartbreaking seeing the impact on patients and the cost of living crisis that is taking place. And we have to say it for what it is. Jason McNally, welcome. Thank you. I love learning about different cultures. Well, stay with Salam Radio and you will get to see so many wonderful programs as well. And it would be a pleasure to give you a bit more of an insight into the Islamic faith as well. And what I think is that we've got to talk about, like you say, whether the prescription charge is needed. I mean, the ethos of the NHS was a free medical service at the point of contact as well. And if we could translate that across pharmaceutical services as well, we could see many a person who would benefit from it. But no doubt we've also seen that there is abuse of the system as well, isn't there? I mean, now there are so many other medications that we can buy over the counter that we are needed to buy, like paracetamol. But with my medical hat on, if I have a patient who says to me they want me prescribing them paracetamol, I give it to them because they have free prescriptions. What are your comments on that type of scenario?
It's difficult, isn't it? Because on one hand, we encourage patients to buy items that could possibly be bought cheaper off prescription, or even to help with the health budget, the drugs budget. However, in the times that we are very unprecedented, we have to be sympathetic to the needs of the patients that come in, and absolutely, if paracetamol is required to be prescribed, then I would fully endorse that.
Yeah, from a medico-legal point of view, we've got to meet the requirements of patients as
Absolutely.
well. And obviously, there are those scenarios where we have to give prescriptions to patients who are bedbound or are in a nursing home. They can't buy paracetamol, can they?
They can't.
Things like that as well. Would you like to tell our patients a little bit about sort of prescribing with regards to creams and emollients as well? These are medications that can be brought over the counter. Are there examples of other medications that can be brought over the counter that otherwise we didn't know? I recently heard that fexofenadine, which is an antihistamine, can now be brought over the counter.
There are a number of prescriptions now that can be, or what we thought were prescription items. And I would encourage anyone to go and speak to their pharmacist before they purchased some of these. So, for example, for indigestion, omeprazole tablets can now be bought over the counter. You can buy Buscopan and Beverine. You can buy fexofenadine.
Yeah.
And the antihistamines. Absolutely, speak to the pharmacy team, and you make use of them. They are skilled. In fact, they are experts in medicines. Pharmacists are experts in medicine. So please go into your pharmacy, discuss with your pharmacist or your pharmacy team, who are equally going to be fantastic. Ask for the advice, and they will give you that advice, and they will also give you the recommended treatment, which is evidence-based.
Yeah, it's a good idea. So if you're listening to this, please do ask advice from your pharmacist if you want information on what medications can be bought over the counter, if you feel that any medication that has been prescribed, and there will be medications on prescription that will be given to you that actually can be brought over the counter. And if you have to pay for your prescriptions, you're better off buying it over the counter. I mean, there are paracetamol now. What's the cheapest that I've seen it? 50p? Is that right? Or you would know better, wouldn't you?
So you can buy it, I believe, at 50p for 16 tablets.
Yep.
But the 32, which is available in pharmacy only, behind the counter, please do ask for them if you need them. And they're enough there for 3 to 4 days supply of treatment, yeah.
And their price?
Their price would hesitant to guess, but you're talking about £1, and I wouldn't expect it to be more than that.
Okay, well, that seems reasonable, doesn't it? And obviously, if somebody's prescribed your price, I mean, again, we used to have a pharmacy first service which used to give prescriptions to children for Calpol and ibuprofen as well. And we have 60 seconds. Brother Hassan, I'm so grateful to you for coming.
Thank you so much for inviting me.
You've given so much wonderful information to our listeners as well. And I'd like to thank all of you. We have Ifet Eunice Davies, who has applied for an HC1 online from here. Thank you so much for that comment, because that was needed. And we will come again next week for a wonderful show, and I'm going to surprise you on who the guest is, like I surprised you with who this wonderful guest is here with me today. But thank you, everybody, all of you who have contributed. Lee, John, Jason, thank you very, very much. And he's just said paracetamol is really cheap in Poundland. Thank you very much for that. And for the rest of you and my listeners on Salam Radio and the Body Health and Mind Show, thank you very much for joining me. It's been a pleasure as always. And this time I will be back next week, I promise you. So don't go away. Jazakallah khair. And